Hi guys, this is Dr. Monisha from Breathe Medicine. After a long break, we'll get back on track in making MBBS easy. First, we'll start with anatomy of lung and slowly pace forward. To understand anatomy of lung, we have to know these five subdivisions: external anatomy, internal anatomy, what are the supporting structures, what is the functional unit of lung, and what are known as conducting and respiratory zones. The major part contains external anatomy, which is simplified using these eight headings. Lobes are present in both the lungs. Right lung has three lobes and left lung has two lobes. If there are three and two lobes in right and left lung respectively, then the fissure separating it will be 1 minus. So two fissures in the right lung and one fissure in the left lung. Pleura of the lungs are of two major types, visceral pleura and parietal pleura. Surfaces include costal surface, medial or mediastinal surface, and diaphragmatic surface. Similarly, borders are of three, which include anterior border, posterior border, inferior border, which is also a circumscribed border. Hilum is also known as the root of the lung, seen in both the lungs. Cardiac notch and lingula are both specific to the left lung. At the top, we start with the thyroid cartilage, followed by cricoid cartilage, and then the tracheal rings. Whole forms the trachea. At the level of T4 to T5 vertebra or angle of Louis, this trachea divides into right and left main bronchus, where the right is shorter, wider, and more vertical, around 2.5 centimeter long, and left bronchi is narrower, more horizontal, and around 5 centimeter long. On the right, we have three lobes: right upper lobe, middle lobe, and lower lobe. On the left, we have left upper lobe and lower lobe. As we discussed earlier, we have two fissures on the right and one fissure in the left. Right lung has an horizontal and oblique fissure, left lung has oblique fissure. Thus, it gives three lobes in the right and two lobes in the left. Left lung's anterior border has an inward curve followed by projection at the bottom. This forms the cardiac notch and lingula. The one we are seeing anteriorly is the anterior border, and behind towards the vertebra is the posterior border. The inferior, also known as the circumscribed border, is at the bottom facing the diaphragm. Now, the surface of the lungs are based on their adjacent anatomical structure. Hence, it consists of three surfaces: costal, mediastinal or medial, and diaphragmatic. As the name suggests, costal surface is the one facing the ribs. If you notice, the lungs will have alternate depression and elevation markings. These are caused by rib and intercostal space with muscles, respectively. At the bottom, facing the diaphragm, we have the diaphragmatic surface. Now we discuss in detail regarding the medial or mediastinal surface because they have relations which are very important in clinical anatomy. First, the right lung medial surface. This is the anterior and posterior for reference. How we are able to say it's anterior posterior? It's based on the position of the structures in the hilum. Hilum, also known as the root of the lung, where the structures enter and exit the lung, is at the center. This white marking is a pleura surrounding the hilum of lung. It is double layered membrane due to the reflection of visceral pleura over the parietal pleura. From here, the reflection extends towards the diaphragm, forming the pulmonary ligament, which anchors and stabilizes the lung to the mediastinum. To make sure it's easier to remember, we'll start with the cardiac compression of the lungs. Anterior to the hilum, we have the impression of right atrium. We all know the major blood vessels entering the right atrium. One at the top, superior vena cava, and one at the bottom, inferior vena cava. Now we have to remember the structures draining into the superior vena cava. On the right side, we have the right brachiocephalic vein and the arch of esophagus. Arch of esophagus runs above the hilum and enters SPC at the level of T4 vertebra. So, what are the other major structures left? We have trachea and esophagus. Anteriorly, we also have impression of thymus and fatty tissue of antemediastinum. In the hilum of the right lung, the main bronchi is typically divided into epiatrial and intermediate bronchus. Epiatrial bronchus is the most superior structure. It's above the artery, hence named epiatrial. Here we are going to denote pulmonary veins in red since it's carrying oxygenated blood to the heart, and pulmonary artery in blue since it's carrying deoxygenated blood from the heart. As you can see, pulmonary artery, blue marking, is located just below and anterior to the epiatrial bronchus. Superior pulmonary vein, which is a red marking, positioned anteriorly and inferiorly to the right pulmonary artery. Inferior pulmonary vein is located further down, typically the most inferior structure in the right hilum of lung. Lymphatics position can vary. So, to summarize, superior to inferior, we have the bronchi, pulmonary artery, and pulmonary vein. Anterior to posterior, pulmonary vein, pulmonary artery, and then bronchi. Now the nerves related to the right mediastinal surface includes phrenic nerve, which runs anterior to the hilum, vagus nerve, which travels posterior to the hilum, and sympathetic trunk runs along the vertebral column and provides sympathetic innervation to the lungs. Lastly, we have the left mediastinal surface. Like we discussed before, we will start with the cardiac compression, which is seen anterior to the hilum, predominantly formed by the left ventricle. Apex of the heart requires more space, hence the impression is more deep compared to the right side. Structure leaving the ventricle is arch of aorta. It forms the arch-like groove above the hilum and then continues as descending aorta posterior to the hilum. Then there's a mild impression of esophagus and trachea at the top, and esophagus becomes more inclined towards the left at the bottom to enter the esophageal opening in the diaphragm. One of the branches of aorta is seen to make impression on the left lung. It will be the leftmost branch, that is the left subclavian artery. We also know that the left brachiocephalic vein travels from left to right and enters the superior vena cava. During this course, it tries to reach anterior to the arch of aorta, hence forming an impression here. Mild groove for the first rib is also noted. Similar to right, left lung also has impression of thymus and anterior mediastinal fatty tissue. Nerves related to the left mediastinal surface includes left phrenic nerve anterior to the hilum, left vagus nerve travels posterior to the hilum, and left sympathetic trunk near the left side of the vertebra. Now we'll see the structures within the hilum of left lung. Superiormost is the left pulmonary artery in blue color. Then comes the hyparterial bronchi, which means the bronchi is positioned below the artery. That's why it's called as hyparterial bronchi. Followed by left superior pulmonary vein and then inferior pulmonary vein. Again, lymphatics can vary in position. So we have covered most of the external anatomy in this video. Only the pleura is left, but it is kind of an important topic, so we'll keep it for a separate video next. Thank you guys for listening. Just a tiny motivation before leaving. Life is very hard sometimes, but giving up won't make it better. Bye guys, this is Dr. Monisha signing off.